Joining us now to discuss just that, we have Adow Pharmaceuticals President and CEO William Stilley. It is a pleasure to have you, William. Thank you for taking the time out to talk with us. So, are you noticing a shortage of available drugs, especially when it comes to cancer and certain COVID treatments? Are you experiencing that?
Yeah, so Tashani, first of all, thank you very much for having me here today. As a pharmaceutical executive, I am not personally experiencing that, but in the country we are seeing it across the whole country, as a matter of fact, and this is pretty distressing.
Yeah, absolutely. I mean, drug shortages is apparently not a new issue. I didn't know this, but there have been drug shortages before the supply chain disruption. Can you talk about that and how the industry as a whole handled it?
Right. So I would say this is a little different, and drug shortages in the past have usually become, there might be only one or two manufacturers of a particular product in the world. And if that, one of them has a problem in their facility, a fire or something like that, you can then have drug shortages. What we're seeing now, though, is really something much more systemic. And so it's a much bigger problem.
Why do you think we're experiencing this shortage, though? Because, I mean, everything is being impacted. Is it truly due to the pandemic?
Well, I think it comes from a couple of root causes. First of all, the manufacturing of fine chemicals, and fine chemicals is a term for pharmaceutical grade, usually in small batches relative to the amount of benefit it provides. These fine chemicals has really been offshored. So we are not making many of those fine chemicals, pharmaceutical grade components in the United States anymore. So when you have a disruption like we're having due to the lockdowns, which have now created the supply chain, backup basically, it affects everything that is not internal to the U.S. at a much greater rate than it is, something that was manufactured in the U.S. And I would say from a strategic sense, this is really a wake-up call in my mind, in that we are not able to produce and support ourselves as a country as far as some of the most critical medications that are needed for our population.
Yeah, that was actually going to bring me to my next question. So does this reinforce the need that America needs to be more self-reliant?
In my mind, absolutely. And in particular, strategic, industries. Pharmaceuticals are something that are important to the health, safety, well-being of society. And a government's primary duty, in my mind, is to increase the quality of living of its population. Defend us, increase our quality of living, and at the moment we have a problem with that.
I mean, America is a place where we are so advanced, one would like to think, when it comes to medicines. Why is this an issue for us to be self-reliant when it comes to producing our own medications?
In the end, as they often say, it usually comes down to money and where the money is flowing. Other countries have been able to produce, sometimes due to labor rates, but primarily due to government support, produce these fine chemicals at a lower cost, per kilogram